I think it will have a significant impact. I don't think that you can do value-based care and do it well unless you're using a platform like that. And I know even 5 years ago, when I was looking for platforms for a medical group with which I was working with, and even other groups since I've since helped them, we're always looking for things that are really bringing together all the pieces, because value-based care, it isn't about risk adjustment alone. And so finding point solutions that are just looking at capturing and evaluating risk adjustment and generating suspects isn't enough. You really need to be thinking about, all the other components that influence that patient's, how they take up healthcare. And so I think it's equally important to identify quality gaps. It's equally important to identify where, social determinants of health may have an impact. And then to the point about interoperability, so not only is it important to have the breadth, right, and the depth of data, or I should say the depth of data, which is what I had outlined, but then you also need the breadth of data. And interoperability is so important because it's going to help you pull together what could seem like disparate points of data. And I know in working with groups that they might think that their EMR or a particular system is enough, their claim system, and it's not. There's lots of other data that you should be pulling in to help you raise those point of care solutions, or excuse me, hang on, Netta. It would be important to be able to bring in all those seemingly disparate data sources so that you would be able to raise them at the important times of when the physician is seeing the patient, or whenever the care team, right, is interacting with the patient, so that you could have an impact. And I think that this is something that we've been tackling with for several years, and looking forward to the solution. And I do think, and just to give a shout out to Persivia, I do think that there are tools out there, Persivia being one, that is, getting through some of these challenges. And so I would say the biggest one is completeness of data. So not only as far as picking up feeds from all the different interactions or intersections that you may have. So making sure that you're not only getting, claims data, but that you're getting, the backend data from EMRs, that you're getting pharmacy data, that you're getting lab data, that your EMR system is set up appropriately so that it's back-coded with CPT2 codes or link codes. So all these things I think are important, and a lot of systems are not set up that way. Systems are set up in a way, or they don't speak to one another. So you may have varying EMRs, different versions set up in a different way. Maybe not all the, the functionality that would be important. I think some of the other challenges is, so like I said, making sure to get all the different data feeds, but then across systems, there's a lack of standardization, which can be a good thing, because I think that's how you get to innovation, but can be a bad thing when you're trying to bring all that data back together and make it, have a cogent story that can help clinicians at the point of care, when they're serving patients. And then I would say too, so not only the data that you're bringing in, but how you're putting that data together. And then, and when I say that, it's, what are the things that you need to pay attention to? So you certainly don't want, I just heard of a company that is going to present all suspects that come in, whether they're historical. So this is specific to risk adjustment, but it happens with other programs, but where they're going to present this myriad of suspects, and it's like you need to have some rules around that. And so, how are you choosing what's going to be presented to the doctor, what's going to be presented to that clinician. You certainly don't want to burden them with a bunch of things to go through where there's a lot of noise, so that, there's a few things there that you stop paying attention, right? If things aren't relevant. And so if you're bringing everything and the kitchen sink forward, it's really difficult. It doesn't help either. And so I think you just burden physicians. So as it relates to challenges with data, I would say, again, getting all the data pieces that are relevant, um, standardizing that data so that it makes sense, um, having the systems that are necessary connected so that they can provide that message. And then the other piece would be, of course, making sure that that message that comes through is appropriate. And it may be different, right? There might be things, that's the thing. I think there's a lot of systems out there that are written in a way that they're very stringent and not very, what I like to think is pliable. And so they're always going to give you, that they're going to follow the same rule set. And I get that that's important, but the rules that work for a health plan versus an at-risk provider group are different. And so you need a solution that's going to be flexible, that you're going to get to have input into the rules. And then again, who's looking at that data? Is it your care management team? Is it your risk team? Is it your clinician? Is it your quality leader? And so really knowing the type of organization and then who's looking at the data and what they're going to do with it, I think is important. And so as I'm thinking about what the challenges are and trying to look for solutions, it's companies and systems that can meet those needs. So one of my favorite things to do is attend hymns, because I think I get to hear about the latest and greatest advancements in technology. And I first heard about, I actually know fire, though I'll say that I'm not, I don't want to get over my skis. So there are folks that know technology far better than I, but sitting in a few sessions, I think fire, now it's been around for a few years, but I think is pretty exciting about what it can provide. But I think that there's some cautionary tales too. So when I think about fire and data fabrics, what I love about it, I always liken it to, and my technical friends might school me on this, but I think of it like, primordial soup. And so it's really, when I think about the difference between, say, like blockchain and then fire, you put out a call, you bring back data. With fire, I really feel like, and maybe I'm not imagining it in the right way, but you can reach your hand into that primordial ooze, if you will, and pull back the things that you need to. So again, when I was just sharing with you about one of the things that I'm interested in is finding these pliable solutions, things that you can mold, given the situation, that really give you that flexibility, so that you can, use data in a way that really conforms or shapes to the situation that you're asking it, right, to support, and that you're asking it, in the way in which you're interacting. So I think that we have, a lot of people complain that there's no data. I think there's too much data. I think that it's in different places, right? And we need a way to, again, bring it together and bring it together in a way that makes sense for those that are going to use it. And not every audience, not every user is going to need to use it in the same way, is not going to need to arrive at the same insight, say, as another team. And so that's why I think, having that data fabric, having that fire and being able to reach in and pull out, the things that you need, those critical insights at those critical points in time, is so important. I had the great privilege a couple of conferences ago to actually a couple conferences ago, but I was able to moderate a session that two sessions with two of your doctors, distinct sessions. So one was with Dr. Shardul Mehta, and the other one was with Dr. Mansoor Khan. And so impressed. And I agree with you. I think I learned more in moderating those panels about AI and the capabilities of technology and all that goes behind it. I learned so much in those sessions. And I know that Dr. Khan in the session that we had, and I know, he's a PhD from MIT, quite impressive, but just the way in which he was able to explain AI and the work that you guys have done and the testing, right, that's gone on around the large language models and all the work that you're doing at Persivia to bring data together, I think is really important. And I don't think I've ever heard, even at that other conference, right, HIMSS, at that particular RISE conference, I'll give a plug for everybody, but at that particular conference, I had never heard anyone break down such a complex topic and really give me confidence in what we're doing and how we're using AI. And I did actually start off with my answer, and I failed to give you the cautionary tale. And that would be the thing that I would say that I would be critical of. And that doesn't mean to think badly, it's to ask the right questions. And so, if you're using systems like this, if you're using data, ask questions, make sure that, the data that's being presented to you, because there's a lot of technology out there right now. And there's a lot of data. And we need to be discriminate buyers. And so we need to be asking the right questions. And if we don't know them, and again, and I started off saying too that I think I know enough to be dangerous and get over my skis. Look for companies that have trusting partners that can, explain what they're doing and share with you, all the 15 years, as you said, but all the work that they're putting behind what they're doing to make sure that, you have that best product. And again, that is inoperable, is making sense of the data, is flexible and pliable, is using the latest and greatest technology, is ruling out the noise, and again, bringing that data forward for whatever point it is along that chain, right, of treating the patient. Because while the office is the primary, there's other points along that healthcare continuum in which you're intersecting with the patient. And so I think that, having technology and a platform that can massage data in that way to meet the needs of where that patient is in their care journey is super important. And again, just to give a nod, I know, I'm friends with Persivia, but that's not because that's not for without reason. I really think that there's been a lot of tried, true, and tested thinking and work that's been put behind the platform and what you guys are doing with data. So I know as a leader making decisions on these types of investments, as well as working with other leaders around the industry, there's always been a concern, right, around cost, and whether or not, where do you invest your dollars, and are you really going to get what it is that you need? And I've seen a lot of platforms implemented at different organizations that didn't live up to what they said they were going to. And so it was challenging. I saw a company that for 3 years had a platform that didn't work and they paid millions of dollars. So cost is definitely a concern. And then now too, because of what's going on with V28, and the other rulings that have gone on, within the last year, it's very difficult, I think, to participate in value-based care. But there's no going back, right? The mantra is, or the edict is from CMS and OIG and others that everyone will be in a risk-bearing arrangement by 2030. Um, so what I would say is that, when you think about those contracts, and I've seen plenty of an ACO take on global risk and not be ready. So what I would say to folks is, how could you not, right? Like, I get that it's expensive and you may get sticker shock. But in my mind, it's not a nice to have, it's a necessity. And so, really thinking about if you're going to participate in this space, and there's lots of programs out there that you can participate in, either working with your health plan partners, CMS, others that have funding. If you're a physician group, if you're a health plan considering this, providing it to your physician groups, I think it's a worthwhile investment. Um, for that reason, because again, it's not an extra, it's not a nice to have, it's not a luxury, like I think a lot of folks think, but it's really a necessity. And the other thing I would say is, we think about these programs. There are ones out there that I think are very uh, are within limits, but you need to talk to your vendors. And what I would do, I think, in these times and just in general, I always want to do business with people that listen to what my needs are, as opposed to telling me, not that I don't need to hear sometimes what I need. I do, but I think I want my partner to be an equal one. And so listen to the challenges that I'm having and really listen. Don't talk over me. Don't rush to the point to tell me why your solution is fantastic. But someone that will listen. And so maybe you don't need to get the full program. So this is why I say this is talk with the person that you're considering, and choose a solution that maybe will work with you. And so maybe you don't need the full-blown program, right, tomorrow. But it's things that you can work on. And so I know we've talked in previous episodes about data strategy. Think about, what the 3-year, 5-year, 10-year plan is to the extent that you can. Got to be flexible because technology is changing, right? And it's always changing, and it's changing very quickly. But be thinking about where you want to go and then have a plan for that. And so I've negotiated deals where I bought a piece, and then I brought on other pieces. And I was very thoughtful. This is why I say a plan is important, is you really need to be thinking about, you can't be just bolting things on and, thinking that it's going to work. You end up with Frankenstein. And so you want to make sure that, you really have an idea again of where you want to go and then what it's going to take to get there, and find a partner that's willing to work with you to hear what your needs are and will help you prioritize how they're going to address those needs. And then also too, then they should be able to offer you breaks on price. Those are things that you might be thinking about. Maybe there's ways in which you prioritize particular populations. So I think that there are ways that you don't have to go out and buy, the Lamborghini, when you can buy the parts and assemble it in your driveway. And I don't know if that's a good analogy. Um, but anyway, I think that there are ways, that um, and ways that you can get to where you want to be and that you can ramp up. And again, it doesn't mean that you flip the switch and everything is running tomorrow, but you can choose what pieces are important. And then also too, I think of it like it's not an extra, it's a necessity. And if you don't invest in technology like this, you're going to, I think, be in a world of hurt. I've seen it. I've seen lots of groups sign up for and think that value-based care, and even in these ACO contracts, that global risk was the way to go and that they could manage it, but they still operated with those fee-for-service systems. And the thing is, that's the whole point of moving folks into these risk-bearing contracts, is that, it's not boding well for healthcare, for anyone, for patients, for clinicians, right? And so it's important that we're doing something different. And again, though, in order to have that paradigm shift, you need the right solutions, the right technology to support it. And so choose a partner. Again, I know I keep saying, but choose a partner that will support your efforts, that listens to you, that understands where you want to go, that will counsel you, right, when you're wrong, because sometimes you're wrong, and that's okay. And I know that's hard for some to hear. But then also too, though, sometimes you're right. And so you want to find someone that it's that equal give and take and will work with you. And you have to have this technology, but you can find a partner that's willing to help you put it together and put it together in a way that it's that it's palpable, or excuse me, palatable.